that's why we have this responsive fund. And so really thank you all again for all of your hard work, for your tireless effort, and for you showing up every day. And let's get started with our webinar today. So I have two amazing colleagues with me that are going to be sharing information around the effort today. So it'll be myself, Megan Folkriff, and Deanna Hilliard. And just know that there are additional team members behind the scenes that have really made this effort possible. Just to give you an overview of the agenda, we'll spend our time really talking today about the details of this funding opportunity. We'll share information more about Interact for Health for those of you who might not be aware. We'll also talk more about the application process, and we really want to leave enough time to answer any questions that you all might have. If you want to drop your name and organization in the chat, and you can share maybe one thing that is bringing you joy, and we're going to jump right into our the rest of the webinar. Next slide.
Next slide.
We can go to the next one. Okay, so really at Interact for Health, we are committed to advancing health justice and changing systems so that community conditions promote good health, and so that no group is exposed to environments that undermine health or well-being. We use our voice and platform to highlight the reality that health is mostly shaped by the conditions where people live. In this effort, our key focus areas as an organization right now and what are helping us on this journey to advancing health justice are really focusing in on youth, mental health, and well-being. We also are focused in on community power efforts that really help community to identify the issues that are most pressing to them and address them. And underlining both of those things are really with a focus in on policy and systems change, because we know that those items really help to make sure that efforts are sustained over time, and also help us to promote good health and make sure that we don't have any unjust policies that are undermining the health and well-being of our community. Next slide. Our values. And so our values are really, really important to us. So a couple years ago, we actually updated our values. And as an organization, we started with thinking about our values personally, and then thinking about our organizational values. And so these are our values listed here. So we tackle root causes. We work to undo and prevent unfair systems, policies, and all forms of racism and discrimination. We amplify community power, acknowledging our privilege as a funder. We know that those closest to the problem are closest to the solution. We speak openly. We don't shy away from hard conversations. We are brave in our words and our actions. We partner with trust. We come to the table with humility, honesty, transparency, and we start by listening. We are relentless problem solvers. We work with curiosity, urgency, and flexibility, and we take risk and innovate and learn from our mistakes. We strive for impact. We work to achieve positive, lasting change at scale, and we are future focused and seek to transform the status quo. And so our values really are the foundation for us as an organization and help to guide our work internally, externally, and also help with decision making. Where we focus, and so we are an independent foundation, and we cover a 20-county region in 3 states, Ohio, Kentucky, and Indiana. And within our region is about 2.4 million people. We also believe as an organization that it shouldn't matter where you live or how much money you make or what race or ethnicity you are, that everyone should have the ability to really shape their communities and access the resources that they need. And so here you see our priority populations. So Black communities, Hispanic communities, children and families in low income. We have our rural communities and LGBTQ plus communities. How we work, and so these are the following ways that we show up and partner in communities. So whether that's through funding, whether that's using our voice, whether that's showing up as a convener, a neutral convener within our community, whether that's amplifying community voice, or serving as the go-to resource for data on health and health justice within our community. So when we think about eligibility criteria, so you must be a public, nonprofit, or governmental organization and providing services in at least one of our counties within our service area. We also, if organization needs a fiscal sponsorship, we also work with organizations who might not be a nonprofit, but they have a fiscal sponsor who can serve in that capacity for them. All right. And so the RFP goal. So again, as I mentioned during my opening remarks, this RFP is really the goal of responding to emergent needs within our nonprofit community. We understand that the landscape is changing. This fund will be up to 2 million, and there's a total of three funding streams available. Next slide. I'm going to hit these high level, and then I'm going to hand it over to my colleague, Deanna, to talk a little bit more in detail about each of these funding streams, decision-making criteria, and who the opportunity is open and available to. So our first area here, our funding stream one is our critical services, are really looking at sustaining our civic infrastructure. And so this is up to 1.5 million in total is available within this bucket. Our sustainability consultation. So this is in-kind support. And so folks in here will be signing up to participate or expressing interest in participating in our sustainability consultation program. And then we have our organizational resilience and workforce well-being. And so this opportunity is only open to our current grantee partners, unfortunately, at this time. And this is really to support the people behind the mission and making sure that they have everything that they need in order to continue to operate at their highest level. And so again, the first area is open to grantee and not, the first two areas are open to grantee and non-grantee partners. And the third area is currently open to only our grantee partners. And so I'm going to hand it over to Deanna to talk more in detail about each of these funding streams and what we're looking for as far as helping to make decisions within these areas.
Good afternoon, everyone. Next slide, please. So I'm here to talk about the three different buckets. And so our first bucket is around critical services, and that's sustaining civic infrastructure. We'll have award amounts of 50K, 75, or 100,000, and we have up to 1.5 million available in grants. This work is around supporting the continuity of critical community infrastructure by addressing time-sensitive and operational and programmatic needs. Some examples, but this list is not exhaustive, includes efforts to support people maintain their Medicaid access due to eligibility and policy changes, immigrant serving organizations responding to sharp increases in demand for mental health and direct services. And so to give you a better picture, Interact for Health strategic plan is really around supporting health equity and justice, supporting youth mental health and well-being, and support for the immigrant population. And so we're looking for proposals around that work, and they should be focusing on critical gaps or unmet needs with deep ties to community relationships. And so the selection criteria that we'll be using for this pool is strategic alignment. Is this work essential to advancing health justice and youth well-being? Is there a demonstrated urgency? There's a clear evidence of time-sensitive needs. Operational readiness. Is there a concrete plan to deploy the resources? Community trust. And last but not least, resource uniqueness, gaps that are not addressable by other funders. This pool of funding is open to both current grantees and non-grantees with Interact for Health. Next slide, please. Stream two, I'm gonna say this multiple times. So our in-kind sustainability consultation program, this is around capacity building support. And I want to be very clear, this is not a grant. This is participation in the sustainability consultation program. And so organizations that are awarded this can work with the sustainability consultant around scenario planning, legal support, sustainability development, fundraising plans and strategies, and implementation, collaboration, shared services, mergers, board development, strategic planning, and revisions. Again, this is not a grant. This is participation in our sustainability consultation program. a couple reminders is there is up to 30 hours of individual support with your consultant. This is a 6 to 8 month program. You can participate with your consultant either virtually or in person. We'll have a November 26th kickoff meeting, and the program will start January 2027. And so, selection criteria, being clear and focused on the priorities that align with the scope of the program, being honest about your barriers, um, identification of self-awareness and potential barriers to this work, and being honest about your needs. If you want to get the most out of this program, it requires you to be honest because we want this program is really for the benefit of the organization. And so really making sure you're honest about what you need and what you need support in. And last but not least, priority will be given to those who have not participated in this program before. We have about 10 to 15 spots available for our in-kind sustainability consultant program. Next slide, please. All right, and our last funding area, we recognize that organizations are under attack, and we believe that people who work in nonprofits are the hearts of the sector. When they thrive, organizations thrive, and communities benefit. And so this work is really about pouring back into staff, really about funding your mental health and the needs of your resiliency. And so example activities include team retreats and offsite planning sessions, mental health supports, wellness stipends for staff, collective care practices, whether that's peer support groups, restorative practice, mental health days. Um, we recognize that the need is very high, but unfortunately, this is the only one that is only available to grantees only. Whereas our other two, where you can be a current grantee or a non-grantee, this one is for current grantee partners only. So an Interact for Health grantee partner from 2023 and now, that also includes our Data for Equity cohorts. And you should have received an email on June 22nd about eligibility. And so priority will be given to organizations that did not receive similar funding through our 2025 rapid response funding, and award amounts will be 5K or 10K, and we have up to 200K available for funding for this particular funding stream. Next slide. So eligibility and selection criteria. Who can apply? Nonprofits, government organizations. You must serve at least one county and Interact for Health's 20 county service regions. Organizations that aren't tax exempt may apply through a fiscal sponsorship with a 501(c)(3) sponsor. And just to keep in mind with this particular grant, there will not be a final report, but grantees will complete a short survey at the end of their grant period. And so, how proposals are evaluated. So, organizations serving immigrant and refugee communities and other priority populations. Interact for Health's priority populations include Black, Brown, Hispanic, LGBTQ plus, low income and rural communities. Is there a mission alignment? Are you working in alignment with advancing health justice and work youth well-being? And last but not least, values alignment. Organizations operating in alignment with Interact for Health's values. So that's all I have. And now I'm going to pass it over to Megan, who will walk you through how to apply.
Thanks, Deanna. Good afternoon. My name is Megan Folkerth, a member of the team here at Interact for Health. Thank you to all of you for joining us. It's good to see so many familiar faces as well as new faces. So there's a couple of different ways to apply. Each funding stream has its own application, and so we want to walk through that and answer any questions that you may have. So I'm going to dig into each of the three funding areas on how to apply. So critical services will be through our online grants management system. If you have applied to us before, that you access through our website, it'll look similar, an application through that. The sustainability consults as well as the workforce well-being are Google Forms, much shorter applications. The sustainability consults again is open to anyone, and that is just expressing your interest in participating in the program. There's no funding tied to that. It's just that we're paying the consultant. And then the workforce well-being, also a Google form that if you are a current grantee during this strategic plan, you would have received the link directly in your inbox for that application. Okay, next slide. So we're going to dig into how to apply for each of these areas. So if you go to our open funding page on the website, you will see the responsive fund RFP. You'll be able to access the grants portal directly from that page, as well as get the RFP document that explains all three of these funding areas. Um, Next slide. There's also on that open funding page, you'll see a PDF and a Word file of the application questions. This way, if you don't want to start in the system until you have access to the questions, or you want to collaborate with coworkers, you can download both the PDF and Word version so you can see exactly what's being asked in the application. You can also see here our scoring rubrics. You'll see that below. There's the different scoring rubrics for all three areas. And so you'll be able to access those so you know exactly how our team is looking at these questions. And then there's a FAQ as well as an email address that you can reach out to us. Okay, so for the first area of critical services, you will go to the open funding page. Go ahead and hit the next slide for me. And there's two different places that you can access our grants portal. You'll see at the top right-hand corner, it is highlighted, and that is on every page of our website. So you can access the grants portal no matter where you're at, or from the open funding page, you'll see in the bottom left of this slide where you can access the portal as well. And if you do have questions about accessing the portal, issues with your account, you can reach out to our Director of Grants Management, Christine, and she can help with that. You know, if you have an existing grant with us, you likely already have an account. There is also a password reset function. If you're having trouble getting into the system, you can use that, but also feel free to reach out to Christine with those questions. Next slide. You will also see, so then highlighted on the right-hand side, a place for an applicant tutorial. This walks you through exactly what you'll see in our online system, do some troubleshooting if you're having issues accessing things. So that is available on the open funding page as well for if there are questions. And then next, I'll show this just gives an application preview of what things will look like in the system. So, you know, we're looking for a title, proposed work, what your grant duration is, start date, but this is what the Word PDF file will give you. You will also notice that we have character counts. If you go to the next slide, be mindful that the character counts do include spaces, and you can see where it will give you when you go into Word, if you're typing in there, make sure that when you're looking at your character counts that you note it the characters with spaces, because in the online portal, those do count towards your character count. We have to put character counts in the system. Please note that, you know, we want enough information to understand what you're doing, but please do not feel like you have to be completely exhaustive and use every single character. That is not the intention. We want to give you enough space to share your information, but please don't feel like every character is necessary. And then also within the application, this is a view of what the grants portal would actually look like. So you can see the title box, you can see the proposed work, you can see underneath the proposed work question, how many characters you have left as you are typing. Next slide, that just highlights there. It'll count down as you do type on what your character counts look like. Next slide. And then you will see at the top, there's functionality if you want to bold things, underline things, bullets, numbers, things like that. We encourage you to use those features. We encourage you to bullet things out if that makes readability easier. Please use those however you see fit. And then there is an additional information box where you can upload a file. If there is something additional you want us to see, please know that this text box as well as the upload file is absolutely not required. Anything that is required, you'll see an asterisk next to that question. These are just, sometimes we have people that want to share something additional or a piece of information that doesn't quite fit into one of the questions that they think is good for us to know. But this is not a requirement. It's just optional if needed. Okay, now we're going to move on to the second area, the sustainability consults. This is a Google form. The link is provided in the RFP document. Um, and you can get access to that. If you go to the next slide, you'll see just a screenshot of the of the application in Google. Again, on our website, you can get the PDF of the questions so you can see them ahead of time. This is a fairly short application. If you're logged into Google, typically it will save your place in the form, but if you're not, it does not save your place. So that's something to be mindful of. I would encourage you to look at the Word or the PDF file and maybe work outside of Google Forms. And then once you're ready to submit, go in and put that information. And Grace has linked the direct link to this Google form in the chat for us. Okay, and then the third area is the workforce well-being. Again, if you are a current grantee during this strategic plan, you should have received an email a couple of weeks ago with a direct link to fill this out. Again, it looks very similar. Google form, same thing. You should have access to the PDF and the Word files. Would encourage you to look at those and get your answers prior to going in, just because we don't want anyone to lose where they are when they're working on this. And then if you have any accessibility needs, modifications to make this application more accessible, you can either reach out to the responsive fund email address that is listed in here, as well as in the RFP document, or to Christine, our Director of Grants Management, and we're happy to help with any of those accessibility accommodations. So then to run through just key dates and timelines, very high level here. You're here today, July 7th, for the application webinar. We will answer questions here in a few minutes about the RFP and the process. It is not required that you attend the webinar, but this also will be recorded and shared on our website following this. The application deadline for all three areas is July 31st at 5 p.m. So either via the portal for the critical services or via the Google Forms for the other two areas, July 31st at 5 p.m. We will notify of awards in September. We don't have an exact date yet, but we will be able to notify during the month of September. So we will notify all applicants of the award decisions, whether awarded or not. And then the next two dates are specific to the sustainability consults, that funding area two. There will be a cohort kickoff, exact date to be determined, but a cohort kickoff in November. That should say 2026, not 2027, November of 2026. That is our fault. We did not catch that. We will update that when we share these slides out. But a cohort kickoff, November of 2026, just to meet the consultants, start to, lay out what your needs are and what you're hoping to get out of the work with the consultants. And then January of 2027 is when the consulting program will actually begin for those selected organizations. And with that, we can open it up for questions. I know there's been some coming in the chat that have been answered. So we can work through those, and then we can also have people come off mute if they have things that they want to discuss.
Yeah, so it looks like we answered the part of like grantees will be notified in September for all of the funding streams. Someone asked, can the project start date be deferred until January 2027? Also for stream one. And so I would just say with that, so these are 12 to 18 month grants. And so one of the criteria in that area, so sorry, looking through all my notes, is around urgency and need. And so I would say that it's fine, but that is a factor that we are looking at and like how quickly are resources going to be able to be deferred, I mean, be able to be deployed within the community. And so, yes, you could, but it's just something to factor in as far as we are looking at that when people submit information. Someone asked, are you asking or to apply for just one funding stream, or are we welcome to apply for multiple? So you can apply for multiple funding streams. Oh, Carly answered that. What is the expectation regarding deployment of resources? Deborah, do you want to share a little bit more around?
Sure. We were just wondering what that means. Like when you say the RFP says you want the resource should be deployed quickly. So we're just kind of like trying to get our heads around what that might actually look like.
Yes. And I think that this is more so because we're looking at things that might be time sensitive or critical. I think just being able to talk about what does it look like to actually start to use funding as opposed to the waiting the waiting period. And so you should already know what you're going to do and be ready to act fairly quickly on the dollars. That is something that we're going to be taking in consideration as far as when we're making decisions. I don't know if anybody else has anything to add to that.
Thank
Yeah,
you.
I would just say, it's intended, we're trying to fill critical gaps in our communities that are needed right now versus like planning for something further down the road or an anticipated thing. And so that's where the quick deployment comes into account there.
Was that helpful, Deborah? Okay. I'm going to answer the
Yes,
last
yes,
question. And
yes.
okay.
I'm sorry. I'm sorry. I couldn't get my
Oh, no,
mouse to
you're
get
fine.
my mute.
We'll go to the next question in the chat. And then, Emily, I see your hand raised. Is it fair to say that for the first funding stream, the most favorable application would be ones that focus on addressing unexpected expenses or interruptions in expected revenue? I don't think so.
I think
Um,
that's part of it, but not
yeah.
necessarily everything. Like, I think we certainly recognize that, some of our populations are under attack. And so there's an increased need for services and things like that as well that might not necessarily be from an interruption in revenue, but more just the policies that have been put into place in the past year and a half, that are causing other issues. So certainly unexpected expenses, interruptions in revenue could be part of it, but I wouldn't say that it's all of it.
Mhm. Thank you.
Thank you.
Emily?
Hi there. For the first opportunity, a lot of the examples that were given for projects that would be funded or could be funded, they were very much direct service type projects.
Mhm.
Would the foundation or would Interact be open to considering organizing work or sort of
Mhm.
policy advocacy work that aligns with the mission and the target populations?
Yes, I would say yes.
Okay,
Mhm.
great. Thank you.
Yeah, the examples are just examples too, and so I wouldn't feel any type of way if you think whatever you're thinking of in particular in bucket area one or any of the buckets, if it doesn't necessarily align, I wouldn't think that you're not considered. We just wanted to pull some examples together.
Mhm.
And so, again, if you have questions that we might not get to today as you're starting to go
Mhm.
through the application, please shoot us like an email, like, "Hey, I'm thinking about this. You think it's a good fit?" We're more than happy to talk with folks.
Okay, I will likely do that. I appreciate that. Thank you.
Yeah, you're welcome. Um, so as do we anticipate doing this again? So our hope is, so last year we were able to have a rapid response, but it was only open to our grantee partners. And so this year we were able to, so we were able to increase our budget by $2 million to be able to do this. And so our hope is to be more intentional moving forward and having a responsive effort. And so we're still trying to figure out exactly what that looks like. And Deborah, I think you bring up a great point around HUD. I think so let's stay in contact because I think those are things of like, how do we start to get more proactive around some of these policies that we know are coming down. And so let's just stay in contact around that specifically. But our hope is to be able to do some iteration of responsive. It might not look the same way that it looks this year, but we want to have that as an intentional area of focus moving forward.
Thank you.
There was another, if we did not apply for these, would we still be considered a grantee for future RFPs? Allison, you want to say more about that?
I can come off mute, Ashley.
Okay.
I mean, because some opportunities are for grantees only. So, like if a future RFP came out that was for grantees, but we had a lapse in funding, would we still be considered eligible for those in the future?
Yes, you said like, does this grant opportunity make you considered a grantee partner? Is that what you're saying?
Well, we are currently a grantee partner, but I'm saying like if we had a lapse in funding for a year or so,
Oh,
would
yeah. Typically
like
with
forever be considered a grantee partner?
we typically like right now we're starting with the launch of this strategic plan. And so next year, folks, regardless, like if your grant ended, if you were awarded a grant during this grant cycle, you would be considered a grantee partner.
Yeah, so people that were awarded at the very beginning of this strategic plan, even if they don't have active funding, are still considered a current grantee partner.
Mhm. These are great questions. Any other questions? Again, you can come off mute and drop them in the chat.
Hi, this is Diane. I've got a couple questions. So I couldn't
Yes.
figure out how to get my hand raised. So for the critical services one, so if you have a facility and you have like, let's say an HVA system that's ready to die on you and it's lived its life and it's a couple $100,000, is that, I mean, because we run our programs and things there, I mean, is maintenance equipment like that, is that considered uh, a con uh, a critical service, or are you looking more for types of programs?
Mm, I think that's a great question. So I think one thing to consider for the first bucket, the opportunities for funding are 50, 75, and 100. And so my initial thinking around that, and team, you guys can chime in too, um, is that it might depend on what it allows to continue. So being able to repair that allows what type of programming to continue, what type of services. I think linked in that type of way could be something that is considered competitive, but just not connected to any mission type of work probably would not be considered competitive. Does that make sense?
Yes. Yep.
Okay.
Thank you.
And again,
And
this is our first time doing this too. And so we're going to see what you all come with. And I know that we're going to have to make some hard decisions. But I will say, really trying to be guided by the information that we share with you all today.
sure.
Team, y'all
And then
have anything to
another,
add? Okay, no. Okay, sorry, Diane, go ahead.
no, wait, thank you very much for that. And then for the if your facility is working with a consultant for the sustainability consultant on like some board development and strategic planning and merger, I mean, is the funding for just consultants that you guys work with, or is it open to consultants you're currently working with? Or should
Um,
that consultant they're working with call you directly?
so we already have a consultant that we work with, that we contract with, and so you would be
Okay.
working with that particular consulting company.
Mhm.
Okay. Thank you.
No funding is actually awarded for that area. We contract directly with the consultant.
Okay. Thanks.
Um, Someone asked, would we team be willing to provide feedback on proposals before submitting? Um, I don't know if it's going to be full proposals, and I'll just be like 100% transparent. We have a lot of people in and out on travel. And so I would say definitely reach out. I don't know if we're going to be able to look at something fully, but if you reach out, like, hey, this is what I'm thinking, that is something that we can commit to. We're going to respond to everybody that reaches out to us, but like being able to look through the full proposal, I'm gonna just be honest, might be kind of hard. But ask questions though, like send us an email. Like we have to respond to that. So please send us an email with your questions, and if we need to hop on a call, people will do that too. Oh, and
As
thank
far
you,
as
Jen.
the email, we'll drop in the responsive fund email. I think that's the best way to reach us because that goes to multiple people. And so that way, if people are out on vacation, someone else will get it versus just getting someone's out of office.
Mhm. Other questions? Again, you can raise your hand or just come off mute and ask your question, or you can drop it in the chat.
I actually have a quick question.
Yes.
For the critical services funding stream, would you say that the different award amounts are maybe based on like discretion as to what that organization may need, or like what would that be based off of?
It's gonna be based off what you tell us.
Okay,
So we wanted to make sure, and so we tried to be very intentional with this bucket of making sure that they were decent sizes because we wanted to make sure uh, that people are able to get done what they need to get done. And so it's really going to be based off of you being able to make the case for whatever funding stream is suited for what you're asking for.
got it. Thank you.
You're
So
welcome.
we just set those three levels for a little bit of ease, given what we're anticipating the request amount to be, but you select which amount you're applying for. There's a budget section in the application.
And so a quick follow-up question for me would be that, like, let's say you ask for 75 and, maybe, your organization doesn't feel that that may be necessary. Will that then go down to 50, or will that more so possibly just look like we can't award you that 75?
I think we're going to try to like whatever you say, we're going to try to honor that. We don't try to
Okay.
like shortchange
Okay.
people of like, hey, well, can you do it for this amount? Like that's not what we're going for. If you need that amount, we're going to try to make you whole.
Okay. Got it.
Mhm.
Thank you.
You're welcome. It's a great question.
There's a question about how long you have to be an organization to get funding. I am Gabby, please jump on if I'm not answering this correctly. I'm thinking you're referring to like if you just got your 501(c)(3) status, do you have to have it for a certain amount of time? The answer there is there's not necessarily a requirement on how long you have to be an organization. Would have to be a 501(c)(3) or use a fiscal sponsor. And then the only other caveat I would say is we are a private foundation. This is like way in the weeds, and we can talk offline about this, but our funds, 501(c)(3)s, have to have so much public support, and our funds work against that public support test because we are private. So if you are new and don't have a lot of other funding, that could be something that we need to have a conversation about to where a fiscal sponsor could be a better option. So happy to chat more about that if you want to reach out to us, or if you want to jump on and ask a follow-up if that wasn't what you were looking for.
Thank you so much. That was actually the exact answer that I was looking for because we just hit a year, and sometimes as a new nonprofit we run into that. But we've been getting some grants here and there from different organizations. So, but I would love to I guess connect later to speak more about it.
Yeah, absolutely. Send us an email and we can set up a time to chat.
Thank you so much.
Mhm. Someone asked in the chat, when defining youth, were programs that support the emotional well-being of youth with disabilities, mental health, or developmental medical learning be considered aligning with your target population? Yes. Can salary or compensation for a program lead be included in the grant budget? Yes. Also, when you say youth, can children 0 to 5 be in that group? What is youth? 14
We
to
define youth as age 0 to 24.
0 to 24. Okay, so yes. Other questions? Chat or come off mute?
Hi, I have a question about Stream One.
Mhm.
I'm not exactly sure how much we would apply for. We've got to get with our finance team about that. But if it's less than 50,000, would those applications still be considered as well?
No,
Okay.
no, and I say, and I'm like, no, because we had conversations around the amount and if it's less than that. Like for this opportunity, we really wanted to make sure that we were giving larger grants, like less but larger grants as opposed to many smaller grants. And so that was our focus right now. And I would say no. But yeah, probably not.
Okay. Yeah, that's great. Thanks.
Mhm.
The only other thing I'll add, I can't remember if we said this, so I apologize if I'm duplicating, but when Laura, you said talking with your finance team, it made me think we are, you can apply to multiple streams, but only one application per stream per organization. So if
Mhm.
you are a big organization, multiple people that have connections to us, we would ask that you work internally and only submit one application. If we do get multiple, I believe we will only look at the first one that is submitted for the organization. So we are asking you to have those conversations internally versus submitting multiple for one stream.
Mhm. We have a question here around working for a nonprofit organization whose primary work is international. However, we run a local student program in our community. Would our organization be eligible to apply under Stream 1 if the proposed project focuses on helping local students develop skills in public health and local health through these local programs? I would say that you would have to think about like what is the critical need that this program is addressing. And so that would be, I would say yes, but you would have to really tie it to the critical need that these students or this program is going to help to really address. You said, can you write a collaborative grant working with someone else? Is that yes? Uh, I guess so. We didn't, I guess you can. Somebody, just one person has to apply, but if you want to write in there that you're collaborating others to address something, yes.
But the money would only go to one, whoever the applicant was. And then
hmm
it would be up to the applicant who received the money to work with other people.
Okay, so we have if a larger organization has a subsidiary org under it that is a current grantee, can the larger organization apply separately under Stream 1? Yes, because it seems like you're serving as a fiscal sponsor for an organization that's a grantee. So the fiscal sponsor, which is the larger organization, could apply. Yes. I would just be clear in the
The title potentially,
you say what?
like in the title potentially, like
Yes.
I'm going to call out a couple people that I know on this call because I know Community Happens Here and Imagine Cincinnati are both on here. Sorry to use y'all as examples. But Community Happens Here is a fiscal sponsor for Imagine Cincinnati. They both technically could apply. We would just say maybe in the project title, say, Imagine Cincinnati and then what it is, and just be really clear and maybe even shoot us an email so that we know to look at both of those because they would come under the applicant would look the same, but they would be different since one's a fiscal sponsor.
Yes. And then there was a question around a current grantee is an organization that has an active grant with Interact for Health. That is not correct. So I would say if you have a specific question about eligibility for if it's like funding stream 3, we can let you know specifically. We sent out specific emails, but it's more of a time frame. If you received a grant in a specific time frame is what is considered a grantee, current grantee partner, not the current status of your grant. So if you have a specific question about an org, we can let you know.
There's a question about the preferred budget. So in the application, I for the two that are Google Forms, you're just selecting what you're applying for and what you're going to spend the money on. It's more of like a narrative for the budget, not necessarily, we don't need a line by line, like a line item breakdown of a budget. And then in the one that goes through critical services for funding area 1, it's kind of the same. There's an amount requested where you put the total amount, and then there's an expense narrative. You do have the option to either type in the box or upload a file. So it's really whatever your preference is, but we do not require like a line item budget with certain areas.
Mm-hmm. Yes, so you can apply for more than one area, but one application per organization. Any other questions? These are good questions. We will we have about 9 minutes left. We'll continue to just stay on for the next 9 minutes. If folks have questions they might not want to ask in front of everybody, but once it gets down to smaller amounts, we'll stay here for the next 9 minutes. Just again, like we said at the top of the meeting, just thank you all for everything that you do, your continued commitment. And please feel free to reach out to our responsive email account if you all have any questions. There are no dumb questions. Ask the questions. You don't know until you ask. And so, like, we are here to support you in your efforts, and we want to make sure that you are set up for success. And so, again, thank you all for joining today. We'll stay on the call for the next 9 minutes or so just to see if any other questions come up. But that's what